If you have a certain group of inherited disorders called cryopyrin-associated periodic syndromes, CAPS, including familial cold autoinflammatory syndrome and Muckle-Wells syndrome, Rilonacept Solution, Reconstituted, Recon Soln, may be used to help lessen the symptoms, including rash, joint pain, fever, and tiredness. It works by blocking a certain natural protein in your body, interleukin-1, that may worsen the symptoms of CAPS. Rilonacept also helps to treat a condition of a lack of the natural protein interleukin-1 receptor antagonist, deficiency of interleukin-1 receptor antagonist-DIRA, and a certain type of heart disease, recurrent pericarditis. This medication reduces the risk of the heart disease from coming back. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. Before starting to use Rilonacept Solution, Reconstituted, Recon Soln, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Follow your doctor's instructions and inject this medication under the skin, usually once weekly. The dosage will depend on your age, weight, medical condition, and how you respond to the treatment. If you are administering this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. The mixed medication should have a thick, clear, and colorless to pale yellow appearance. Before using it, check the product visually for any particles or discoloration. If you notice either of these, do not use the liquid. Make sure to also learn how to properly store and dispose of medical supplies. Before injecting each dose, clean the injection site with rubbing alcohol. It's important to change the location of the injection site each time to avoid any problem areas under the skin. Do not inject into skin that is tender, red, or hard. Use this medication regularly to receive the most benefit from it. Try to use it on the same day each week to help you remember. It might be helpful to mark your calendar with a reminder. If your condition does not improve or worsens, be sure to inform your doctor. If you experience any bruising, itching, pain, redness, swelling, or hardening of the skin at the injection site, these are common reactions that usually go away after 1 or 2 days. If they persist or worsen, consult your doctor or pharmacist. Remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. It's important to be aware that this medication may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infections. If you notice any signs of infection, such as a persistent sore throat, fever, chills, or cough, contact your doctor immediately. Additionally, this medication can impact the levels of cholesterol and other fats in your blood. Your doctor may order lab tests to monitor this and prescribe treatment if necessary. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so be sure to contact your doctor or pharmacist if you experience any other effects. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Rilonacept, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history, especially if you have breathing problems, cancer, diabetes, or immune system issues. Rilonacept can increase your risk of getting infections or make current infections worse, so it's best to avoid contact with anyone who has a contagious illness. Be sure to let your healthcare professional know if you are using Rilonacept before getting any vaccinations, and also before undergoing any surgery. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. It's also important to consult your doctor before using Rilonacept if you are breastfeeding, as it is not known if the drug passes into breast milk. When taking Rilonacept Solution, it's important to be aware of potential drug interactions that can affect how it works and increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use, including both prescription and non-prescription drugs, and discuss it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Rilonacept solution include anti-cancer drugs, corticosteroids, drugs that block tumor necrosis factor, TNF, such as adalimumab, etanercept, infliximab, and other drugs that block interleukin-1 such as anakinra. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. If someone has taken too much Rilonacept solution, Reconstituted, and is experiencing severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they can contact their local poison control center for assistance. U.S. residents can call 1-800-222-1222 and Canada residents can call their provincial poison control center. It is important not to share this medication with others. Your doctor may also conduct lab or medical tests while you are using Rilonacept solution, Reconstituted, Recon Soln, such as cholesterol, C-reactive protein, and serum amyloid A. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember, unless it is less than 24 hours before your next scheduled dose. In that case, just wait for your next dose at the regular time. Do not take a double dose to make up for a missed one. After mixing the Rilonacept solution, Reconstituted, Recon Soln, you should store it at room temperature away from light and use it within 3 hours. Any unused portion should be discarded. It's important to keep the unmixed drug in the original container in the refrigerator away from light. Remember not to store it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.